Hello, everyone. A very good morning, or good afternoon, good evening, whatever it is when you're watching this. So, we are going to start off with the live series called Alternate Ways of Connecting with Nature. And this is the fourth episode that we are doing today. We started it off a few weeks back where we shared about what are the various other ways that we can connect with nature. So far, we are well known with connecting with nature in ways that we are aware of, and there are some very common ways of connecting with nature, which includes probably reading about it or going butterfly watching, bird watching, taking photographs, or just going on vacations to nature spaces. So, these are very common ways of connecting with nature. But in the space of connecting and having a deeper connection with nature, I myself have experienced so many varied ways that we can connect with nature that can go beyond an intellectual way of connecting with nature, where I might not know the names of a tree or a plant or a bird, but I can still connect with those nature elements. And in this space, I have also spoken and met a lot of people who are doing amazing work of connecting with nature in such varied ways that it always excites me to listen to how they connect. And a lot of them connect from a heart based, soul based level also. And this series called The Alternate Ways of Connecting to Nature is an endeavor so that we could spread information to various people as to how we can connect to nature in different ways. And you could obviously choose which way resonates with you, or it could just help you expand your knowledge. And I'm sure a lot of you will connect with different things that people do in this world connecting with nature. So, our first episode was about connecting with nature and meditation, which was just my own experience. And then we had another episode on how we can connect with natural colors, how we can make natural colors and connect with nature through that too. You can watch that in the IGTV if you have missed that one. And yesterday, being World Environment Day, we also connected with Shruti, who spoke about wild edibles and how we can really notice things that are growing out in the environment, which we may have forgotten, which we may have missed out on noticing, but they're a very important part of the ecosystem. And these wild edibles are also very nutritious and have a lot of medicinal properties. So we celebrated World Environment Day yesterday with Shruti, and today we are going to celebrate World Environment Day in a different way, where we're going to connect with the inner environment. Yesterday it was the external environment. And what do I mean by inner environment is there is as much as the outer nature, there's also an inner nature that each human being has. And thankfully, because of the pandemic, the whole conversation about mental health has increased because it is a very crucial aspect. The more we are able to take care of ourselves, we can also take care of the outer environment. What I mean by that is the more we are self aware, the more we are more grounded, we can also work with the outer nature and environment so that it comes from a very deep space of intuition or knowing, and it's not coming from a space of helplessness or anxiety, which is what I see a lot of people working towards environmental issues or eco warriors. There is a sense of anxiousness or anger and anxiety of doing something for the environment, which they may not realize could actually harm in the longer run. So, mental health is one of those aspects that's very close to my heart, and I really do believe that this is something that each one of us need to look into deeper. And it's been an amazing journey of connecting with Tanya, and I'll just join Tanya while I introduce her too. So, Tanya has been and it's been absolutely interesting, and we've had a lot of interesting conversations on various aspects because we do both believe in taking care of ourselves, our mental health, and being part of nature to do that. So she's also quite passionate about connecting nature, adventure, as well as mental health. And hey, Tanya, welcome. Good to
Hi.
see you.
Hi, Vaishali. So good to be
Yeah.
here.
And thankfully, Tanya and I met before the pandemic hit. So we had beautiful conversation in a beautiful nature park. And yeah, it was really nice to see the authenticity with which she's working towards bringing in something that's new in India, which is adventure therapy. And I remember the conversations that we had where she had been for some of the conferences, right, on adventure therapy conferences. And I think
Right.
you'd just been to Sydney at that time, or
Yeah.
US. Yeah, one of
Yeah.
those conferences. And you were so excited and you were sharing so much about it that it really got me excited. And I'm like, okay, definitely I'll be there for the next conference of adventure therapy. But COVID happened. But it
Right.
was really nice to hear you speak about it. And Tanya is very passionate about it. So she's been practicing adventure therapy here and also advocating how important it is and how it can work. And what I love about Tanya is that she doesn't just stick to textbook information. She kind of uses her own intuition of bringing things together, bringing knowledge and wisdom together along with her own experience and knowledge to see what will work best for or what will serve the other person best. And that's where we also connected very beautifully. And she does have a private therapy practice, so she has a lot of clients that she works with. So yeah, and without me sharing more about her, let's hear it from her. Yeah. So yeah,
Thanks for
Tanya.
your really kind words, Vaishnavi. And yeah, I think that morning we spent together in Kaban Park has really stayed with me as well, and I'm so glad that could happen this Sunday. So yeah, thanks for having me. I'm excited to be here with you for the
Yeah.
half hour.
Yeah, we'll try to keep it half hour, but our conversations
Yeah.
usually last longer
Yeah.
because there's just so much to talk. And so
Yeah.
yeah, we are going to aim for half an hour and then 10 minutes of question and answers. But those who are here
Right.
on the live, feel free to put in your questions whenever it pops up in your head. And but we'll take it towards the end, and Tanya will share her experience with that. So Tanya, maybe you could just give a little more information about what exactly you do, so people get to know about adventure therapy.
Sure. So, I'm a mental health practitioner. So, I've completed my master's in clinical psychology and then now running a private practice. And while I was sort of figuring out, what my approach was going to be and studying, I also realized that there's something called adventure therapy where I can practice outdoors with my clients. And really, ever since then, there's sort of been no looking back because I've always connected with nature from a very young age, and so this just felt like, yeah, this makes sense. It makes sense that we collaborate with the natural world for our healing. And a lot of stuff I was learning already didn't make so much sense to me at the time, and so this really felt like coming home. So yeah, I essentially have been training in adventure and nature-based therapy. There's so much to learn, so I continue training in different aspects of it. Um, but I also practice and like narrative therapy, and I have a somatic approach. So apart from private practice, also running a support group for people with disabilities is something that I'm really passionate about and that I learn a lot from. So yeah, would you like to know more about like what nature and adventure-based therapy looks like?
Yeah,
Is
sure.
that
I
what
mean,
you
maybe you
mean?
could share a little more. I think someone's asked that question also, just curious as to what adventure therapy is all about because it's so new. And what does it look like for someone who attends it, so it's easy for people
Mm.
to correlate.
Yeah, that's such a it's a good question because the joke is that any of the adventure therapy conferences that I've been to, that for as many different adventure therapists that are present, there are that many different ways of practicing it. So essentially, it's an umbrella term. Because adventure therapy includes also like horticultural therapy where you're working with plants. It also includes like animal assisted therapy and approaches like equine therapy. Also includes more like nature connection kind of work that you do, Vaishnavi. So it's really a large framework rather than a methodology, I'd say. And so it's really about finding different ways, and I think each practitioner finds their own sort of flavor that they bring to their practice. So in my case, I think it's more of really spending time in nature, so more of ecotherapy sort of stuff like forest healing, which is something Vaishnavi and I are trained in together, and also doing backpacking with my clients. Like in the past, what my work has looked like is working with people with physical disabilities and able-bodied people to promote social inclusion through adventure sports. So, although that wasn't really therapy, it was more sort of therapeutic work. We'll talk more about that, I guess, at some point. Um, but we use adventure sports as a methodology and a tool to promote social inclusion, where we took people with and without disabilities on cycling expeditions together from Manali to Khardungla, or they participated in marathons together. And all as really with the goal of having just interaction and having them play together, So with that particular population, it was about, really addressing the fact that we haven't really interacted with people with disabilities usually, because there's so much segregation and not enough inclusion. And so we really don't know how to approach each other or even be friends because no one's really taught us and we haven't had the chance. So it's so that was what our work was more focused on in the past. Um, and yeah, so it can look like so many things.
Right.
Um, but primarily it's experiential. So it's really more of a hands-on, like immersive approach. We're outdoors in nature, and it's also about, embodiment. So you're really connecting through the senses to the natural environment. You're connecting to your own body. Um, it's also about it's systemic. So we're really looking at how we are all connected because that's what we fundamentally believe that, that all of us are connected and we need to, the most of our problems really arise from this disconnection that we are experiencing. So that's also one of the basis of ecotherapy and of nature therapy. We really believe that a lot of our challenges are due to this disconnection.
Okay,
So
interesting.
yeah.
So correct me if I'm wrong. So it kind of consists of taking people out into nature and also having an adventure component to it. So it could be trekking or hiking, cycling, all of those, but with a particular focus on receiving some therapeutic benefits, right? It's not about completing a marathon, or it's not about practicing for a marathon, but it's about. So how does that actually work? I mean, so for example, if let's say I approach you and would like to go for, is it one on one? Is it a group thing? How does it work?
So yeah, that's the thing. It can look like many things. So I'm going to use the example of my work to explain what it looked like in our context, but it can be one-on-one. So there are also like therapists who do walk and talk therapy, where they'll take their clients to access nearby nature and be, walking with them through a park and connecting them to natural spaces. So it doesn't also have to be that you're going somewhere very far away and climbing a mountain. So it really is a spectrum. So it could really be like some therapists will just include, elements of nature in their therapy room. So that's really where also how some people do it, where they have plants around and they have other natural elements as a part of their work. And then it can go up to doing like a 20-day self-supported backpacking expedition where you're in a group. And so, yeah, essentially, I really can't highlight how much it can look like so many different things. So I'm just want to limit it. But I
Yeah.
can see what it's been like for me and how I've been doing it.
Yeah. So it sounds
So
like
it's
there's a
quite a
lot of
range.
room, a lot of fluidity, and a lot of room for bringing our own gifts and our own way of functioning with nature and our own connect with nature into
Yes.
the therapy space. And then, so if I approach you as a client, you could decide what really works for me, also based on my issue or what I've shared
Yeah.
with. So it could be going cycling and talking, or it could also be just walking and talking, or it could just be sitting in nature space and doing. So it might not necessarily be adventure in the colloquial
Yeah.
sense of adventure as we know of, right? Is that right?
Right,
Yeah. So,
exactly. And it's not a one size fits all approach. So we really check with our clients, first of all, what is their existing relationship with nature? Not everyone has a positive relationship with nature. Some people have had a lot of trauma in the outdoors as well. And that's also where my journey began, where a lot of my early childhood experiences in nature were very positive, but in the outdoors, in the adventure space, were not. And so I'm very aware of that and very cognizant of the fact that not everyone wants to also do, just like any other therapy, right? You have to see if it's a good fit for your client. So um, we really check in with our clients, like what's their preferred way of connecting with nature? Is that something that they want for themselves? And often the clients who come to me also, as we speak, we realize that they do have, early memories, that positive memories of being in nature. And then it's really about that process of reconnection with a part of themselves that is really lost or forgotten. So so yeah, like you said, like that's a really valid point that it's not a one size fits all thing. We really check in with what's your way of being in nature and being out. Yeah.
Yes, it sounds like a banquet of things, and we could choose what really works, and that's one of that. So,
Yeah.
just curious to know, so is there like a structured course that one does, or is there like some certification where there are certain aspects that are like kind of fixed, but you can also play around with it later on once you get, is there something like that that exists?
Mm, so not in India yet. Not yet, because what I've had to do was like I also just found out about this field after I had completed my master's. So at the time, there are master's programs abroad that have do like say a master's in social work, plus they have like an outdoor component where they'll train you in outdoor skills as well. So it sort of becomes like a dual degree kind of program. So there are a lot of programs abroad, I think that you can look up, but in our context, not yet. So I've had to kind of really pick up stuff on my own, and really it's been like a puzzle, really picking up different pieces as I go along. So just to name a few of those pieces, I think there's an outdoor leadership training program that I had done, which was really just preparing me to take groups out safely in the outdoors. So that's, of course, safety is something that we really can't like talk enough about. It's so important, both physical and emotional safety, right? So there are courses, outdoor leadership courses that you can do that will train you in a particular outdoor skill. So that if you're someone who wants to use kayaking, for example, with your clients, then you need to go do a kayaking course or be certified to do that. That's not something I use. I just want to do like simple trekking and backpacking expeditions. So that's something that I'm trained in. Then also trained as a wilderness first responder. So really, to ensure that if there's any kind of medical emergency in the backcountry, then we're able to handle it till we're able to get the person to a hospital or get medical care. So yeah, there are different skills that you need, like also to work with groups, like is something that therapists aren't trained in. We're trained to work a lot one-on-one, not so much to work in groups. So there are courses for that. Um, yeah, it really depends again on what you see yourself doing eventually with the tools, and then according to that,
Yeah.
there's also certification by the Association of Experiential Education in the US, which is a certification for clinical adventure therapists. So where you can submit all of your training, and then they'll let you know if there are still some pieces missing. So that's just happened this year in 2021. So that's something you can look up.
So it sounds like it's still in the nascent stages of development, this whole space, right? I mean, and that makes sense because there's suddenly nature-based healing and nature-based therapy work is kind of evolving in different formats, right? Eco psychology and forest therapy, and now it's kind
Mm,
of, I think all over the world people are realizing the importance of it. So it's still in its formative years, I would say. So it looks like adventure therapy is also in that space of really, like you said, you had to, it's still like a jigsaw puzzle. So you're still trying to put pieces
yeah,
together, and it's good in one way because it gives you the freedom to choose what resonates with you and do only that. Yeah. And when you were talking about kayaking, I suddenly remembered there was this movie I saw recently, I forgot. the name of the movie, but it was a true story about a lady based in Australia who met with an accident and lost her legs, and she was like devastated. And the entire family went through a tough time. But she went into kayaking, and
Mm.
that really brought up a different her. She really connected with herself, and you were talking about therapy and therapeutic, and maybe if you could share a little more about when does any kind of even adventure therapy, when do we use nature as therapeutic, or when do we say it is therapy?
Yeah, this is such a good question. Because I think a lot of things are therapeutic, right? Like nature is
Art,
therapeutic, art is
cooking,
therapeutic,
gardening, yeah.
cooking is, catching up with our friends, watching a movie. I mean, many things can be therapeutic, and I'm not discounting them because I think we need all of them, especially as a mental health practitioner. I'm constantly checking, like, what are my clients' resources? What are the other things that they're leaning on that are giving them a sense of strength and support? And so, while those things are really, really important, there is a difference between doing nature-based therapy and, sometimes people will say, yeah, like art is my therapy. And I'm like, yeah, it's a little bit different. Like it can be therapeutic, but it may not be your therapy because, in a way, with nature-based therapy, um, there is a it's like a so it's the prescriptive use of adventure and nature for a specific goal that we are trying to accomplish. So just as a psychologist, a mental health practitioner will have certain treatment goals and will check with you that, hey, like if we're here right now, where do you want to be at the end of this process or this journey that we're on together? So similarly, like with adventure therapy, there are outcomes and goals that we're working towards, and it's very designed that experience to support you to achieve those goals and outcomes. So, yeah, so I think, does that make sense? Does that
Yeah,
highlight?
it completely makes sense. Like when you say is that, when we do use therapy, it is with a particular direction, with a particular goal, like you said. It's whereas when it's therapeutic, it kind of happens on its own. It's organic, and we feel good, and it could be short term or maybe slightly longer than short term. But in terms of therapy, and I totally understand, because when I do art therapy, there is a goal and we go towards it, and all our sessions are geared towards that. It's not
Hmm.
just allowing whatever is happening at that time. Whereas therapeutic is when I am using art at that moment and I'm feeling something, and that gets released, or I talk to someone and I feel lighter or I feel good. So it's therapeutic, and both are, like you said, equally important. Just that the way we use, and I get that, because a lot of people would say, yeah, music is therapy for me, but it's not exactly therapy. It's therapeutic, because therapy would be with with some kind of an agenda, right? And it is goal based, and becomes with some amount of diagnosis, some amount of information from the client, and then we go move towards it. So yeah, absolutely, it makes sense. And yeah, I'm glad that popped up, because it helped me also articulate it in my head, because
Yeah.
there was a dissonance when people would say, or people would do these group art therapy sessions online, and I'm like, how would that work? I mean, it's it's very in the moment kind of a thing, and in a group, then it's not really therapy unless it is continuous, or you do it
Hmm.
over as a
So,
process.
right. So adventure-based work and nature-based work, the therapy work, we also do in groups. Just saying that that's also one of the sort of, I think it's really wonderful to be outdoors with a group as well. So that's something, because what happens is that we're really having a chance to show up as ourselves,
Yeah,
nature, because it's really hard to not, because when you're
yeah,
outdoors you really end up showing up as your authentic self, really learning social skills. So especially when there's been a lot of trauma, it's quite difficult sometimes to be in groups.
yeah,
This
absolutely.
is something that I love about the adventure-based work as well, because I think it allows for, maybe building some interpersonal skills and figuring out, how do I show up and how can I practice some skills that I've learned recently within this small group and then transfer them to the larger world that I live in. So yeah,
Yeah,
that's also,
that's
yeah.
also there. as long as there is some objective and a goal that either
Yeah.
you do it individually or in a group,
Yeah.
then we can add the therapy concept. Or of course, and having some kind of a background in therapy. I mean, I see a lot of people just using the words loosely, saying I do art therapy or I do nature therapy, but not actually being a therapist or having some kind of a background in it, right? I mean, psychology background or some kind of background which helps. So that's also equally
Mhm.
important, I feel like. And you know what, you were also sharing one thing that really clicked for me, and I was thinking of question from there is mention about outdoor leadership training that you had attended, right? Oops. Looks like there's a technical glitch. Are you able to hear me, or is my internet stopped? Or is Tanya's internet stopped? Hi, are you all able to hear me? Because I'm not too sure if my internet has stopped or Tanya's internet has stopped. So those who are on the live can probably put in the chat. Okay, you can hear me. Yeah, I guess we lost Tanya. With technical glitches, it's really difficult, and Insta Lives are still new for me, so I'm not too sure how it works. Um, yes, Naren also agrees. And yeah, and in the meanwhile, you all could also check in with some questions. I know there was one or two questions that someone had asked. I think Partha, you had asked about adventure therapy, so I hope that answered. I think she's already spoken quite a lot about it. Did I miss out on any other question? I'm just going through some people around us.
Sorry, I'm
Hey,
back.
hi, it's okay. Yeah, welcome back, Tanya. I always say like technology has a mind of its own.
Yeah,
So
and something
just like
new
nature,
happens
we
every
can't.
time. So,
Yeah, it's completely fine.
yeah, okay. Yeah,
Yeah, I was
sorry,
just
you were
going through the
saying.
chat. Yeah, I was just going through the chat and seeing if there are any questions that needed to be answered.
Yeah.
Yeah, I was just thinking about the outdoor leadership program that you were talking about because, I'm also a leadership facilitator for quite a few years, and I know there are a lot of people who do outdoor programs, where they would take people out, blindfold them, and take them on a trek, or leaders from corporate spaces, or they would and somehow I would mostly see ex-army professionals having a setup, and they would have these obstacle courses set up and tents and everything. So is there like a difference between those usual outdoor training programs that people do for corporate versus what you do in adventure therapy?
Yeah, definitely there is. But I also wanted to say that, um, when we differentiate between adventure therapy programs and just going on a trek, right? Like with a trekking company. I mean, there are so many outdoor professionals who take people on treks. I think what I realized at my last job when we were working with really taking people with physical disabilities outdoors is that there's also a really big difference in, I mean, and privilege is something we need to talk about because not everyone has access, right, to the outdoors. And this is something I feel really passionately about because there are so many ideas around who belongs in the outdoors, who's fit enough, who's strong enough, what kind of body type you need to have. And whereas nature we know is for everyone, right? It's for everyone. The outdoors are really, so something I'm passionate about is really making the outdoors more inclusive. And often these companies or organizations, they either not trained to take certain populations outdoors, or it's really expensive actually going outdoors. Often can it costs money and not everyone has access to that. And so I think that's where at Adventures Beyond Barriers Foundation, we were really passionate about saying, hey, no, we want to take people with physical disabilities outdoors because often if they approach one of these companies, they would say, no, we're not trained to, and we, it costs this much money, or we don't think you can do it. It's a risk for us, or you're a risk to everybody else. And I mean, it also makes sense if they're not trained to do it to not, so that you don't
Not to
put
have it.
them
Yeah.
at risk
Yeah.
also. But just to say that I think we can't talk about this without talking about privilege and how certain people have more access. And so, yeah, I think it's the intentionality is really what separates it from other kinds of work. There are a lot of outdoor education programs, for example, that are geared more towards uh, working with children to maybe help them to learn what they're learning in a classroom, usually learning it outdoors in a more experiential way, or learning other life skills. And all of that work is so wonderful and valuable. But again, it really, what distinguishes this from that is the population you're working with, and what do they want from this experience, really. What are they there for?
Yeah.
Um,
Makes sense.
so yeah, and also we focus a lot on emotional safety because we're working with vulnerable populations, right? So we really focus on that aspect a lot.
Yeah, that that
Yeah.
makes so much sense because I remember a couple of years back where we there was an organization that I was working with and to do a forest therapy walk for 20 women, and one of them was wheelchair bound, so she didn't come for that particular session, and I was feeling really bad. At the same time, even I was feeling handicapped of how could I really support her, being specially abled and in a wheelchair, because our forest therapy walks, as you know, it involves some amount of walking and using our senses and all of it. So yeah, I think your kind of background would have come in handy in those kind of spaces so that we could include her also and not exclude her amongst those 20 people,
Mm,
because I had absolutely no clue what I could do, and I think
mm,
what you share, and outdoor training programs in the corporate world is mostly geared towards how can they become a better leader, what are the skills that they require and what they've learned, and overcoming fears and things like that. But I think adventure therapy would be in a different space of what the goal could be, about inclusion, about emotional safety, as you mentioned, and psychological safety.
yeah,
So I can see that there's a it may
yeah.
kind of look as if it's similar in the form, but I think the intentionality, as you mentioned, and the essence of it seems to be quite different, right? So yeah,
And
that
also
makes a lot of
has
sense.
a lot of similarities as well, right? I
Yeah,
just want to
of
say there
course.
are a lot of similarities. It's more mainly the intention.
Yeah.
And also that, with some of these, I think I've noticed, like when I was also working, I've done a little bit of work in the outdoors with corporates and, teams, and sometimes we were also training everyone to do this like teamwork, collaboration related stuff. And sometimes we really need to ask ourselves, like, is that what they need to learn? Are they even going to meet each other after this? Why do they need to work out together as a team, and why do they need to learn how to do that? So again, really having a very clear intention of what will really support this person, and what are they here for, so what are their hopes.
Yeah, makes sense.
Yeah.
Damn cool. So I'm really getting to learn a lot more now in this conversation about the work you do and how interesting it is, and so many things that, like you said, to learn, right? And I'm sure a lot of people who are watching us right now, or even will do in future, might probably be more interested in it, And now during the pandemic, there's very little adventure therapy that one could do, right? So is there something that they could do? Do you have some kind of workshop or anything that supports them to continue on being
Mm,
curious and they just want to learn more about it? I think you had some support group that you mentioned.
yeah, yeah. And I think just before mentioning, like, yeah, the study group that I'm running just for people who want to learn more. Um, Sorry, am I still online? And my connection is
Yes,
behaving
yes,
funny.
yes.
One
Yeah, yeah,
second
we
now.
can hear you
Just a
clearly. It's
second.
okay. Yeah, and while Tanya's coming back, Hini, you had asked a question about how you like the initiative for the specially able person, and you would like to know more about inclusion or mainstreaming. So I think I'm guessing some of it must be answered by her, but what she was about to share is something that might really help you, where um, she also runs a support group, as she mentioned, which I think she'll give more information about now. And you could be part of that support group, I'm guessing. And I think she also has a study group, as she was starting to share about.
Oh
Yeah,
no, I'm so sorry. I
nah,
don't know
it's
what's
okay.
happening.
Yeah, there are other people who are
So,
answering for you also.
yeah,
So there's Adventure Shani who says you run
yay.
groups really well and fun activities too.
Hi,
Yeah. So I was
Shani.
just reading, yeah, I was just reading Hini's questions where she wanted to know, she was quite interested in the differently abled um, aspect that you were talking about and what's the roadmap for her to be part of something like that. So yeah, but you could share about your study group and maybe that might help her.
Sure. Sure. So, currently teaching this year, January this year, we started this adventure and nature-based therapy study group. It's really a co-learning space where we all come together to learn more about the subject. I've been fortunate to have a lot of friends around the world who do this work, and each of them has their own way and style of working, and they're basically inviting them as a resource for us to learn from them and to ask them questions. And I've also been trying to create like a video archive of some of these conversations because primarily there are not enough resources, I think, also for people to learn more. So we're trying to create a community of people who want to learn together. And then we also are making this archive. So you can just DM me and I'll send you the link and you can join us on the second Thursday of every month. Yeah.
Okay. So it's an online, is it on
Yeah.
Zoom
And
or
it's not
something? Or
only online. Yeah, it's online. It's open to anyone, really. So you don't have to be a therapist. You don't have to be an outdoor leader. You might just be curious and interested in knowing more. And yeah, just drop in and see if you want to hang around and learn more. So yeah.
okay. So your voice was cracking a little in the beginning. So let me see if I could summarize that so that in case it was for everyone else or not just me. So you do run a study group where you invite people from across the world who might share about adventure therapy. Oops, and I think our internet is gone again.
Yeah.
Yeah, maybe Ishani, since you've been part. Ah, okay, she's back. Yeah, I was just going to take support from someone
Yeah.
who's been part of your group. Yeah, so you just invite people from across the world who are experienced in this space in adventure therapy to share the experience, and people who are curious can attend the sessions, right? Is that right? And it's on
Yes.
second Thursday every
Yes.
month, you said.
Yes. Yes.
Okay. And they can DM you for the Zoom link and they can feel free to just attend whenever.
Yeah.
Um, yeah, Partha is already saying he wants to join in. Yeah, that's
Yay.
great.
Hi, Partha.
Um,
Yeah.
there's another one. It says
There were some
Kiki's
other
reading
questions, but
service.
I've lost all of them.
Yeah, I'm just going through it. So he says, I want to know, is adventure therapy limited in the ways it can treat or help certain people with specific problems? For example, will it be helpful for someone with an eating disorder?
Yeah, this is a really good question. So, the research on adventure therapy shows that it's just like any other therapy. It is more effective with certain populations uh, versus others, right? Because it's so. For example, it's very effective with people struggling with substance abuse and addiction, and it's also really helpful for people for like youth at risk and people struggling with anxiety. What it's not, and what it's really, I think, what adventure therapy really, I think, maybe not such a good fit for people who are really dealing with extreme cases of depression, I would say, where it may be very hard. So I'm saying adventure therapy may not be the best, but we can figure out how to include nature in our work and in our approach. But adventure therapy may not be a good fit if someone is not really feeling like getting out of bed or is not feeling very physically motivated to really move yet. So we would work towards that maybe and see if that's an option. And they've also found that compared to other other approaches for eating disorders, such as like residential treatment, adventure therapy was a little bit less effective. So they found that for something like extreme case of eating disorders, maybe more of like residential treatment and including nature-based work rather than physically strenuous like outdoor work could be helpful. So yeah,
Yeah.
you try that it is nature in combination with other therapies for something like eating this.
Hmm.
Yeah.
Yeah, makes sense. And there's another question by Partha who's asked, is there a possibility to work on some of the mental health challenges that can involve adventure therapy and gradually reduce the medication usage, like completely you go off medicines? Is that a possibility?
So there are studies that show that children who are on ADHD medication, when they are outdoors, for example, they almost need a much, much lower dose of the medication to be able to really function. So that's one thing that they've already studied that often with something like ADHD and also for people who are diabetic, when they have lived around nature, there is research to show that they can do with a lower dose of the medication, because I think especially you're also really a good person to talk about this because of your work, right, with forest therapy. Just to say that we know that there are these cancer killing cells and that it's really helpful, that being in nature is really helpful in terms of building immunity, reducing inflammation. So yeah, definitely it has a really big impact. So I don't know if you to completely get off certain medications. I know people who have, but I do know that about these two, three studies where they really say that you could lower your dose of the medication that is required and yourself off it. Yeah, what would you like
Yeah,
to
makes
add,
sense.
Rajni?
Yeah, I completely agree. I guess it is like we spoke about earlier, we can't have a one size fits all for this particular because there's so many variables for each person. There's so many things that the dynamics is different for each person. So the intensity of the mental health challenge, the past experiences, childhood experiences, amount of dosage that they take, and all of it. I mean, there's so much to include to really say whether it's possible to go off medication or not. But I can definitely vouch that it can be reduced to a larger extent. And like you said, it may not be just using only adventure therapy because I do believe in holistic approaches, when it comes to working with the client. You can't just say, I'll use only forest therapy or I'll use only art therapy or I'll use only, it's like a combination of different things, which also intuitively comes for some of us who learned a lot of modalities to work, whether it's psychological, spiritual, all of it, right? So I think it's very difficult to pinpoint and say yes, definitely for any of the questions that's been asked so far, right? It's a tricky
Hmm.
answer, and I think it may sound diplomatic to say maybe, but that's the reality also. Yeah.
Hmm.
And there was another question also
Yeah.
about the duration of the sessions, the study group. I'm guessing Naren has asked. Naren, correct me if I'm wrong. Is it that you're asking for the duration of the study group session or an adventure therapy session? And he's also asked if it is a day long or month long. So, in case you want to elaborate on that, Naren, feel free. So I am guessing he's asked it when we were discussing about the study group part that you were talking about. So maybe you can share how long that is.
Um, the study group meets for an hour and a half every month online. And it depends, right? Like in terms of the work, also like for example, in the past when I do one-on-one sessions with clients, they'll be and we're outdoors together. It maybe 1 hour, 1.5 hours. With our forest bathing walks, it could be 2 hours, 2.5. I feel like the longer the better because it takes a while for people to get into that experience. But often it's limited to 2.5 to 3 hours. um, what I'm working on though is to develop a program here in Himachal, where we really spend like we do multi-day expeditions. So we spend, up to a week outdoors together. It could be even up to 10 days. So there would be different. And then sometimes we can also we do shorter 1 day treks and hikes. So it really depends. Depends. Yeah. But either
Sounds
of
good. I
these.
think yeah,
Yeah.
whatever Narain's question was, geared towards, I guess you answered both. So that's great. Is there any other questions that you would like to ask Tanya about mental health, about how nature and mental health works together, or uh, anything at all? Feel free to just type into the chat. Or, of course, Tanya is always available. So we'll be putting this video on the IGTV, and I'll also put the link for her um, Instagram handle, so you could always be in touch with her. She puts amazing posts that are related to mental health and other courses that people are doing in the space of mental health and nature. So you could always reach out. She's a very open-hearted, giving person, So she's um, very giving in sharing information and knowledge. And there's another question that someone has asked.
Yeah.
A demo grid. Seems like adventure therapy would have an important role to play in gender studies and combating patriarchal norms in the outdoors. Would you agree? Simrita is
Oh,
saying.
yeah. This is such a good question. Thank you for asking this question because, yeah, it definitely, and also not just patriarchal norms, but also norms around ableism, right? Because essentially, when we were working with people with physical disabilities, and I think that's what we were really uh, noticing all of the time, that that's really what these norms are, what got in the way of people being able to fully participate and really reap the benefits of being outdoors. And I think that these norms impact all of us, right? So we definitely engage, and I'm also a narrative practitioner, so I can't do this work without talking about these dominant discourses in society that impact us and that interfere really with our experience of being outdoors and being in nature. And so we really have, that's really also what we're doing essentially on expedition, right? We're having conversations about this. We're having conversations with how these norms interfered with our preferred relationship with nature and how they continue to. So we talk about like colonization and patriarchy and ableism and the way that we as human beings really dominate nature and other ourselves. And so yes, there's a lot of this that we speak about. And so yeah, thank you for asking this question. It's very important.
So it's not just about focusing on just mental health issues, but I see like there's a broader spectrum where there's conversations on challenging certain norms and aspects that have been part of our narrative without us knowing. And Kiki's also asked, Kiki's leading service. I don't know if that's your name, Kiki. The person's also asked in connection to Simrita's question about whether you identify as a woman, whether that's limiting in any way as an adventure therapist for you. Has that come in the way for you?
Mhm. I think it's an opportunity, really. And I mean that I've had to do a lot of unlearning, really, and I've had to really dig my feet into the ground and say, no, like I belong here. Like I can be, uh, also, I don't have to fit into a stereotype. I don't have to be a certain way. So I don't see it as limiting. I think as women, we bring our own sort of I think we bring our own presence and flavor to whatever it is that we are doing. And so no, I think it's actually really a beautiful opportunity for us to also unlearn this conditioning, right, that these discourses have taught us, and about strength. I think that's really where my personal journey has been about. That it's been about these ableist norms and patriarchal norms that really tell you like you're not strong enough to do this, you don't look like an outdoor person, why have you painted your nails like pink? Like, I don't know, whatever. Just ideas, like rubbish ideas, rubbish. Like, it's not, it has nothing to do with how capable I actually am in the outdoors. But there's just so much fluff around it. So, as we unpack that, we invite our clients also to unpack those aspects of their identity, right? Uh,
Yeah. And it
Yeah,
really
so it's
shows that
an
you
opportunity to
walk your
have those
talk.
conversations.
Yeah, it's not just
Yeah,
up in the air and having
yeah,
conversations, but and knowing you
yeah,
really live it. I mean, knowing that you moved from Pune to Dharamshala, now you're living on your own and practicing in Dharamshala, that itself shows that different aspects of
yeah.
adventure is within you. It's you embody it. And that's where the authenticity also comes in, and
And
that's
it's
why I
a
love
journey.
the work that
It's
you
a
do.
journey, I think. And
Absolutely.
yeah, and I think that, I think what helped is seeing all these really badass women at these conferences who were wearing multiple hats and wearing beautiful short dresses and had like PhDs and families and were outdoor leaders. And I was just like, wow, like I can do this my way. I can do this the way that is authentic to me. I don't have to feel like an outsider, to it. So, so yeah, it really helps to have other women who you lean on, who remind you that there's no right way to be, really. So,
Sounds good. I think that's a wonderful way for us to maybe end this live. We've already gone, 10 minutes beyond our time.
yeah.
But it was so lovely talking to you, and it was really informative. And I hope people who have been part of the live throughout, thanks a lot for being part of it, and hope you gained a lot of information. And of course, Tanya is always available on Instagram if you want to ask anything. Of course, and for people who will watch it in future, you can always get in touch with either of us if you have some specific questions relating to mental health and nature, because we both believe that nature can play a huge role in mental well-being, and we are experiencing it ourselves because we're living it, and we are able to see it in our own walks, and people who come for our sessions in our clients as well. So yeah, just hoping that nature space, and we really can, as Patan mentioned, go off medication maybe if possible, and have that as a goal in the long run. That would be really lovely. So thanks a lot, Tanya, for being
Yeah.
here, and thanks a lot, everyone. A lot of people have said that it's been really brilliant chat, and they absolutely loved. Thanks a lot, all of you, for asking wonderful questions and also allowing us to learn from each other's answers to expand our own knowledge. This will be available in IGTV, so feel free, if you probably enjoyed it, you would want to share it on your Instagram story so that it reaches more people if you feel that more people could resonate with this or get some information. And of course, Tanya's study group is always there to continue learning more about this space, about adventure therapy. Yeah.
Yeah.
Any parting thoughts,
Thank you
Tanya?
so Thank you so much. No, thank you for holding this space. And yeah, it's just, I really enjoyed our conversation. Sorry about this internet trouble, but yeah, thank you.
That's okay. And we hope to see. So the
Okay.
series will continue. This is the fourth episode. We have an amazing lineup in the coming months. We have someone who's going to talk about how to communicate with trees, probably have telepathic communication with animals, and all of that. So look out for the space on Nature Connections, and you'll get to know more about our future talks that we'll be having in alternate ways of connecting with nature. Have a wonderful Sunday, all of you. Bye, Tanya.
Okay, bye. Thank you.